What is a laboratory diagnostic? In this case, we're going to look at blood work, but you may be looking at radiology. You may be looking at urinalysis. You might be looking at biopsy. But for the most part, most people's interaction with a laboratory is through blood work. That is the principal way with which you, your family, your friends, your enemies for that matter, are necessarily going to be treated by the doctor through a laboratory. Now, I have a good bit of experience in dealing with laboratories. You know, I own two. I'm a highly complex laboratory director. I was also an analytical chemist before I was a doctor, which puts me in a kind of an interesting, if not desirable position to be in with regards to understanding the limitations, the limits of error, the limits of detection, understanding the statistics that are necessary to fully appreciate laboratory and laboratory work. So what are they? What this is an objective measure, very much like looking at any other number in any other type of analysis. So if you're one of those individuals, as am I, that enjoys watching detective movies.
I love it.
Oh, yeah. I spend more time watching detective movies because it just seems to be my kind of entertainment. It's what I do for a living, and it's kind of what I do for fun, too. So when you're looking at a detective movie, the first piece of information that pops up is rarely the most important one. There are many pieces of data, some of which will pull you down a rabbit hole and some of which will pull you towards the ultimate diagnosis, but never singular in nature. That is to say that it takes more than one piece of information in order to find out the ultimate diagnosis, to find out who killed whom or whatever. So what's a laboratory? It's basically an objective measurement. So it could be, again, blood work, urine, it could be biopsy, it could be a lot of different things. Now, what does this mean in terms of the result? So you're going to go out and, because you're very, very smart, you're going to look this up on WebMD and you think you have strep throat, so therefore you are going to order the following tests, right? So what is sensitivity? Okay, with all of your medical school background, what tests would you order? What would you do? When I was a third-year medical student sitting on internal medicine rotation, you know, they're sitting back presenting a patient, and then the attending would get up and ask one of the medical students, okay, now what labs would you order? Knowing full well, okay, that the medical student could identify the bacterium under the microscope, could understand the pathophysiology, understand the anatomy very, very well, but wouldn't necessarily know why, when, where, or how to order up a lab study. More so, they wouldn't even know how long it would take to run it. So sensitivity is the factor. It is the characteristic of a particular test that tells you whether or not it's likely to pick something up. So how frequently will it be able to pick up a problem? What percentage of the time will it do or detect X, Y, or Z? That's sensitivity. So there are going to be false negatives, which is to say that the test may show negative, okay, but how many of them are false? False negatives. And we're hearing about this with regards to the COVID testing, aren't we?
Yeah.
Okay, I've done over 25,000 COVID tests. Okay, I can talk to you about false negatives and false positives all day long. I could talk to you. Specificity. That is how sensitive or how good is this particular test at determining a particular problem at all. And what this does is it talks to you about its ability to be exclusive. And when this thing is highly specific, it means it's going to have very few false positives. So false negatives and false positives, sensitivity and specificity, these are the characteristics of the tests that talk to how appropriate they are, how good they are, and whether or not you need to either repeat them or to do an additional test for confirmation. So it gets down to this. So you're going to go ahead and you're going to try to figure out what's going on with yourself. So you are going to sit down with your little book and you're going to decide, well, I should get a CBC, shouldn't I? Because most everybody gets CBCs. Well, the joke is that's the way the doctors think too. They always order up a CBC with their lab work for reasons that remain entirely unclear to me. It's the most commonly ordered blood test, and it's the one that gives you the very least amount of information overall. And yet, that's just the way it goes. And so you can only detect that which you search for. So if you're going to go ahead and look for hepatitis, you better know what to look for, because you're not going to pick it up with a CBC. You're not going to go ahead and pick it up with an ostase. You're not necessarily going to pick it up with lipase, for that matter. You're not going to pick it up with a lot of different specific lab tests. So it's important for you, the consumer, to understand what's happening when your doctor, your nurse practitioner, your PA, or the person down at any lab test now decides to help you decide what you're going to get. So this is not Star Trek. Life is not Star Trek. You don't wave a little tricorder over somebody and goes, and it tells you what's wrong. You have to ask the machine what is wrong. And then there's something that you just don't expect necessarily, and that's that you have to wait and wait. And sometimes it takes a lot of time, and sometimes it takes just a bit of time. But nothing is instantaneous. So you need to know what rock to look under. Wickedly important. You need to understand that it's going to take some time to figure out what's wrong. And then you may need to come back to confirm. So Star Trek is a fiction, reality is reality, and that's the way these things go. So that's just fact number one. Fact number two is that routine laboratory tests detect very little.
That's because they're routine.
They're routine. So you go in once a year, and what are they going to do for you? Well, they're going to go ahead and they're going to get a CBC. Oh, that's good. It just tells you whether or not you have anemia or leukemia, for that matter. Hopefully you have neither. You're going to do a GMP that's looking for kidney issues and looking for liver issues. And generally speaking, and we're going to get back into a second, there's always some abnormality in there, and then we're going to look at lipids. What does that work out to? About $35 for that lab panel. What does it get you? And the answer is $35 per. And we're going to come back after these messages, and we're going to start talking about what you need to know.
Stages of Life MedicalInstitute.com, always accepting new patients, but more importantly, new challenges. Give them a call, 407-679-3337 tomorrow morning.
Yeah, there you go.
Because there's nobody there right
Nobody
now.
there right now.
You can text us right now if you'd like, 23680, and stand by because the doctor is in. Oh, boom. It's only
There we
delayed
go.
by a second or 10. Hi, guys. How are you?
Now we're talking. So I'm sitting there trying to work out getting my phone to work. I used to have I had a beautiful analog clock that worked on my phone. I don't know where it went to.
Well, do you have...
Update, and bam, there it went.
Wait, what do you got? You got an iPhone, right?
Yeah.
It's there.
Well,
Yeah, it is.
it's got to be here someplace. In any event, I'm not the tech wizard. So
You have timer.
well, it's a good timer. Yeah, that's useful for.
Stopwatch.
Got a stopwatch.
Mm-hmm. Now, what do you want?
I want the analog clock. So I can sit back and know when we're going to break.
Analog.
When do we
clock?
take our
That's not
cigarette
happening.
break?
Anyone? No, that's not gonna happen. You don't get an analog clock.
There was an analog clock on this thing until they upgraded it.
Yeah, I remember.
Yeah, they upgraded me out of what I liked best. That also is part of the typical lab work of life.
Okay, so we got some people that have texted in.
The butler did it. I like it.
Let's see, we got here.
And the butler did it.
Is there a cash pay discount offered? Yeah, some people's insurance do not take. So you have friends
here's the
good.
cash pay discount.
Okay.
We charge 1/7 of what the big box labs cost. Okay, is that enough of a discount? We charge 16%.
Oh,
I'd say that's a pretty good discount. Yeah.
Sounds pretty solid.
As it turns out.
All right, so if you have any questions, if you're watching us on Facebook or Twitch or Periscope or YouTube or any of the other myriad, I don't even know at this point, just ask your question in the comments and we'll try to get to you during the commercial breaks, which we have another minute left of today. So, but you're talking about labs, and I like that.
Yeah.
Because I think it's funny. The one in the other room is like, let me go get this, and I'll go to any any lab test.
Any lab test now, which charge you the same as the big box do. It's expensive.
But then they're like, so what do you need? Well, I need to check my cholesterol. Okay, we'll do. And they
that's like
it's hit or miss.
That's $15 in my office. We'll do a lipid panel.
They do it for
$15.
$50.
Right,
I
50.
think,
Yeah, exactly. So we charge less than a third.
Again, so there's where I had to push a button because for some reason it was, and then it went, and now I have 9, 7, 6, 5, 4.
There we go.
I know, right? Radio. It's
Oh,
like,
good.
it's so cool. It's a new
Without
thing.
a net.
It's new now. I know, right? Flying by the seat of our lab coats.
As it were.
You know, if you have a white jacket and a clipboard, you can pretty much get anywhere nowadays.
Oh, there's no question about it. I mean, you want to get a date?
Right.
It used to be you had to wear those little pagers.
Oh, the
I still have
pager.
my pager.
I bet you
It's
do.
got notches on it.
Stop it. Welcome back to Stages of Life Radio. 407-422-1212 if you want to get on board with a question, or you can text 23680. Dr. David Klein, though, is finishing his monologue about, without interruption, I might add, about labs and what the heck they mean and why would we bother.
Yeah, and so I guess a little bit more on this. Then we're going to start taking calls from people that have an interest in their own health, I would imagine. So when you're looking at routine lab work, well, you go once a year and you get routine lab work. Most of the time, they don't even do a urinalysis anymore routinely, something that drives me completely crazy. But in any event, so you'll look at cholesterol issues. You know, you're going to see the obvious thyroid problems, not the subtle ones. You may find suggestions of hepatitis and anemia. But for the most part, these screenings are not screenings at all. Okay, really what you're looking at is you're looking at very, very narrow pokes at the bear. A real laboratory screening needs to be a broad net. Why? Because if you're going to come in and pick something nasty up, you really have to look for it. And that's just not typically done. And why isn't it done? Because a lot of doctors, a lot of the other practitioners simply gloss over what's going on. You're going to come in for your routine test. That becomes a triage game. So if you're a woman, you come in, you get your mammogram, you get your pap smear either done or turfed out. You're going to get your bone scan if you're a little bit older. If it's appropriate, you might get your colonoscopy or your Cologuard ordered. But there really isn't a lot of any other interaction done because they're not expecting to find anything. So many doctors' offices don't even do EKGs anymore. This is a $17 test. This is nothing. So they send you to the hospital for $150 or $200 because you can't get out of the hospital parking lot for less than $200 instead of doing it in their own offices. So these screenings, annual screenings, are pretty, in my opinion, pretty useless. So what I prefer to do is actually cast a broader net to find things that need to be found. Why? Because the earlier you fix a problem, the less costly it is, okay, the less aggravating, and the more likely you're going to pick it up. So, we do these cancer antigen screens. Your insurance will not cover it. Why? Because they don't cover cancer screening like that. But if you had breast cancer already and you're undergoing chemotherapy, well, my God, then we need to keep an eye on your antigens, maybe. It doesn't make any sense when you can pick something up easily. So again, we do those things at substantial discount when it's appropriate to do so. So I have people call me up, well, can you do my cancer antigens? I'll go, maybe yes, maybe no. If you're at risk, if you're in the right age group, if you have the appropriate history, then yeah, I'll go ahead and I'll let you do it. Otherwise, I don't want you to waste your money. So laboratory tests. So what are the obvious sources of error? This is very important. Very, very important. How do you make mistakes with a lab? Well, the first thing, the most interesting one, is the wrong patient. You end up with a blood patient, let's say, mismatch, or a urine patient mismatch. You have a problem going on that is sometimes very difficult to pick up later on. The last thing you want to do, okay, is to go to a doctor's office where they draw the labs and don't get the labels on right away. So in my office, when they go in to the patient room, we have 30 exam rooms. So they'll walk in, patient will sit down, we'll draw the blood either in the room itself or at one of the two draw stations. But the labels are already printed. They're already printed and usually either on the tubes or adjacent to the tubes. So that way it goes nowhere without it being properly labeled. When we do PCRs for COVID or anything else for that matter, they are labeled before they're used on the patient. It's the way these things go. So you just don't want that. So wrong tube, wrong transport medium, bad result. Then it gets even more interesting. Okay, so what do you do about things like heat, cold, and light? So I'm going to go to my doctor's office, and they're going to draw my blood, and they're going to send it to whatever lab, whatever my insurance says they have to, which is always a good way to go. It goes out in a little box out in front of their office, sits in Florida heat at 130 degrees, 140 degrees, And now, what do you think would happen to that blood if it were milk or wine or beer? It would be bad before the sun set, let alone before it makes it to Tampa to be processed and run, if it's done at all in Tampa. So you end up with bad results due to something called sample handling. Bad temperature, vibration, light, heat, or cold. Somebody's going to go ahead and draw your blood. You're going to sit down and they're going to draw a tube. And what's the first thing the technician frequently does as they set it down? They shake it. Have you ever noticed that? They take the tube and go chut and shake it. What that does is it jacks up liver enzymes immediately. So all of a sudden, somebody whose LFTs should be in the 10 to 20 range, they're now 30 to 40 range. Marginally hepatitis. We need to go ahead and spend $1 bajillion on a hepatitis panel on you, and/or the myriad of things that follow because some bonehead technician shook the tube. So when I send people out, I caution my patients to tell the technician, do not shake the tubes. Don't shake them. Be gentle. Set them down gingerly. So to the point where now the technician's going, oh, you're Dr. Klein's patient. So, yeah, this is what you were supposed to have been taught, but they weren't. So delay in running a test. Okay, if you don't do a CBC within 12 to 16 hours, it's going to go sour. You're not going to be able to get a good result out of it. So we try to do our CBCs within an hour, if not faster. So no shaking of the tube. You want to get things done quickly. Then there's something called the standard error of the estimate. Okay, now this is an interpretation error. So, they can go ahead and they can measure it. They can draw it through a syringe. They can do any manner of different things to get the blood into a tube. They can measure it on the machines. The machines are fairly standardized. We have the same machines that they have at Quest, LabCorp, and the bunch. They're nice machines. They're beautiful machines. They're my toys. I love these machines. However, in Florida, in the middle of a thunderstorm, sometimes you end up with electrical blips, and you can end up with what are called laboratory errors. It is just the same thing as happens on your computer. If the power goes out and it comes back on, you're going to end up with corruption of data. So should you end up with a singular lab error, what the lab should be doing is rerunning that lab test to make sure that it is accurate and that if there's something wrong, there it is. So we always draw, at stages, we always draw an extra tube. So if there's some problem like that, we have the material to go ahead and rerun it without asking you to come in and get poked again, because everybody just loves doing that. So error is an interpretation. Okay, this is where it gets interesting. So failure to get all of the data. Well, what does that mean? Well, it means that when you got your annual, they did a TSH, but they didn't do a T3, T4, TPA, or an ATG. So you're going to miss maybe 80% of the patients with thyroid disease. Didn't get all the data. So they got your testosterone but didn't get estradiol. They got your estradiol but didn't get your testosterone or progesterone. And if you don't get all of the data, you don't have any of the data. So it's known, okay, in this particular field that if you don't have enough estradiol, your thyroid isn't going to, your pituitary is not going to kick out TSH, and you're going to become functionally hypothyroid. So doing a thyroid panel without an estradiol gives you information that is non-necessarily interpretable.
Gotcha.
And then failure to recognize relative values. Relative values. That'd be the height weight attitude. So, well, if you're 6'4", you can carry more weight. If you're 5'10", 5'2", weight, it looks different. So you need to understand things in ratio, in context, as opposed to as a singular piece of data. So age is never looked at as a singular piece of data. It's viewed in context. So you have a 72-year-old white man. Okay, you have several pieces of information taken in context. It's far more likely that individual is going to have a prostate problem than a 61-year-old female, of any race for that matter. So you need to understand things in context. Misunderstanding of the standard error of the estimate. So if you're looking at a number, it's plus or minus a value. So if you're 6 feet tall, it's plus or minus half an inch perhaps. So what do you do with regards to hematocrit? What do you do with regards to blood sugar? What do you do? So generally speaking, rule of thumb is it's plus or minus 10 to 15% because biological systems really fluctuate with time. So you need to understand ranges. You need to understand relativity as it pertains to stability. What about height? Okay, so if normally you're 5'6", and then you come in 2 years later and you're 5'4", those are both normal heights, right, for female. something changed. That something might be
Osteoporosis.
osteoporosis. All right, what about weight?
Just guessing.
Yeah, well, we've gone over this one once or twice. So changes are important. So everything is taken in context. So when you're looking at these lab values, this is not something that many of the physicians are actually doing all that well. The mid-levels, not as well. And if you're going to go out and do it yourself, I guess that might not end up as perfectly as you might think.
Yeah, and it'll probably cost you more in the long run.
It'll cost you more in the short run.
Yeah, in the short run as well. Got a lot of questions on our Facebook page, Stages of Life Medical Institute. We'll answer those during the commercial breaks here on the radio, and then we'll be back to take your questions live on the phone, 407-422-1212, or you can text us. We have a couple on deck already at 23680. Stages of Life Radio live Sunday afternoons at 4 o'clock on News Radio WFLA Orlando. Still trying to find my way over to the push button here. Can't do it. Can't do it. I was so close. Wait. Wait. I got it. And boom. My God.
Success.
That was horrible. Okay, we have a lot of questions.
You know, they ought to put that
online.
thing out there in Braille for you.
It's not even that. It's just teeny little dot. It doesn't even give me an arrow. All right, so, all right, here we go. We got Steve. He said, I want some advice for a runner who vapes besides quit vaping. He's working on it.
We want some advice?
Yeah.
Okay, runner. First thing, what do you want to do? Do you want to improve your endurance? Okay. Oh, he's talking about eosinophilia?
Yeah.
Oh, okay. Well, so he's worrying about vaping, and he's got eosinophilia. Allergies generally result in eosinophilia. Okay. So what type of allergies? You can see either extrinsic asthma, you can see intrinsic asthma, you can see issues with medications. There are many things that can cause eosinophilia, including parasites. So what would I do if I were you? I'd get a better history to find out why you have eosinophilia. Now, could it be something along the line as some of these eosinophilic issues? Eosinophilic esophagitis, eosinophilic pulmonitis? The answer is yes. So, yeah, what would I do? I'd really look into it. About the vaping, I'd get the heck off of it. And it's not so much the nicotine that's in it. I'm assuming that that's what you're vaping. But it's the solvent that causes the problems. And that may be what's causing your eosinophilia. It'd be worthwhile checking into it. What do we have next on there?
I got if Pfizer and Moderna are mRNAs and J&J is old school and best for variant COVID, what do you think we should get both types of vaccines?
No. Okay, for starters, play in your own sandbox. Okay, what you're doing here is not very helpful to you. The Pfizer and the Moderna vaccines, as well as the J&J, are all very good with regards to the new variants. It doesn't really make a great deal of difference at all. Not even hardly a bit. Otherwise, they would be preferring one and pushing one over the other. But the Pfizer and Moderna are my preferred vaccines, not because they are new school and J&J is old school, but simply for this reason. They're more effective, 97% effective as opposed to 62 or 63% for the J&J. That's the first thing. Second thing is J&J is having issues right now with coagulopathies. This is 1 month down the line or longer. People are starting to get into trouble with J&J. Now, it's rare, but it's still something that needs to be worked out. Moderna and Pfizer, what's the worst thing that's going to happen? You're going to feel like crud for 6 or 8 hours. Now, is that better than getting COVID? The answer is you betcha. Is it better than having the cardiomyopathies, the neuropathies, the encephalopathies that you get from late effect of COVID? You bet. So get the darn Pfizer. That's the better of the two because it's a 3-week cycle. Moderna if you can't get the Pfizer, and J&J is for people who are needle.
All right, welcome back to Stages of Life Radio on News Radio WFLA Orlando. Wow, goes to the machines. Of course, it is not pretty outside unless you like rain. I like it, but yeah, like a little bit here and there, not just.
Yeah, it was a deluge.
Yeah,
It's
that's
marvelous.
come on, can you handle it? Just a little here and there.
Yeah, my irrigation was on last night, all night long,
What a
as
waste.
it's supposed to, and what do you know?
What a waste. So anyway, welcome back to Stages of Life Radio. We have lots of questions and things to answer, and if you want to get on the phones and talk to Dr. Dave or to our lovely operator, 407-422-1212. Here's one off the text line at 23680. How long after taking prednisolone for 7 days can I do the annual blood test?
Well, the question is, what are you looking for?
Yeah.
So methylprednisolone is probably what you took, sometimes known as a Medrol dose pack. And people are given that for rashes. They're given it for many reasons that necessarily make no sense to me. But it does, in fact, shut the adrenals down, and sometimes that can take months to bounce back. So with regards to your annual blood test, where they're going to be looking at a CBC, they're going to be doing blood, kidney, liver issues, you could probably do it after a week, and it wouldn't make a lick's bit of difference for those because they're not sensitive enough to pick up the prednisone anyway. So worst thing it's going to do is it's going to lower your white count a little bit. So if you have an infection going someplace, you'll miss it. If you do a urinalysis, it'll knock down your white count, so you might miss it. Prednisone is something that doesn't work real well in the presence of infection. So be real careful that way. So if you're just going in for a routine test, routine lab work annually, it's not going to make any difference. And I would just go ahead and run it after a week. But if you're looking at things like gonadotropin levels, cortisol levels, pregnenolone levels, prednisone is damaging to your system. So be very, very careful and don't take it very often.
Isn't that a steroid?
It's a steroid.
Yeah. I mean, it can do some damage and block stuff.
Oh, I've taken it twice for asthma. Pneumonia, really. And both times I hallucinated so vividly. The first time I was seeing dead people, I thought I was losing my mind. And the second time I figured, well, college kids pay a lot of money for that. So I enjoyed it for that 2 days.
Really buzz out. No, I've had it several times. Sometimes to clear my lungs, I believe.
Yes, well,
Sometimes for my eyes.
Yes. Now, your issues, okay? Sometimes you have to do what you need to do, but you can use topicals for the eyes, and it tends to work a little bit better anyway. As far as the lungs, the place where you really get into trouble with it is when you do it frequently. And inhalers are every bit as bad as the injections.
I stay away from that. I do the ones daily, but I stay away from the rescue inhalers.
Well, doing something like Advair once a day is a heavy dose of steroid. It will shut your adrenals down.
It's Bria.
It will shut your adrenal glands down. So we check cortisol levels every 90 days for individuals that are on those things. And you'd be shocked at how quickly the cortisol levels will drop to 2 or 3. And then you find yourself not sleeping.
Wasn't that another reason that you put me on the folic acid?
Yes. I put you on the folic acid for a very different reason, actually.
But that's all in a way.
It bangs around. It's irrelevant. It's not irrelevant.
All right, here's another one we got. Does prednisone affect your A1C or glucose?
Yes. Okay, if you're taking prednisone on a daily basis, as people often do for things like rheumatoid arthritis or individuals that are receiving chemotherapy or some individuals that have, let's just say, very, very bad lung disease, it will chase down what it does, it chases down your cortisol, but your A1C and blood sugar glucose will go up. It is something that will trigger or will mimic diabetes. So prednisone is very strange that way. Is it real potent? The answer is no, but it does build up over time.
Most definitely. Okay, we got one off of our Facebook page here. PID patient does not make titers with flu vaccine.
Okay, I'm not sure.
I'm not sure. Will that be the same with the COVID vaccine?
And the answer is no.
More info. COVID with or CVID.
Well, yeah, she's talking about, or I guess it's a she,
yeah.
is talking about getting monthly IV immunoglobulins. And I'll tell you what I would be doing if I were you. I would be getting the Pfizer vaccine and then get quantitative gamma globulin against COVID. Now, at Stages of Life, you're going to love this one. So it's kind of like almost like a paid intro. I do believe we're the only lab in the country that can quantify the amount of COVID antibodies in your bloodstream.
Wow.
Yeah, we're it. So it's not enough to say, well, yes, it's positive or no, it's negative. I can tell you how much.
Mm-hmm.
Why is that important? Because it helps you know what the burnout's going to be. So if your level is 2 or 3, you're going to end up with 90 days worth of protection from COVID. If it's 20 or 30, like my wife Tess has, she's good for 9 months to a year.
Really? Good
So
for you.
in order to know this, it's a simple blood test. You can quantify the amount of gamma globulin this way.
All right.
So I know they're not doing it at the big boxes because I order it and they don't do it.
Nanette has a question saying that if your hematologist tells you your white blood cells are 15,000 and referred you to a lung specialist, even though my dad had leukemia, she says, are we in the right direction asking for a friend?
Asking for a friend depends on how old the patient is and what else is going on. So a white count of 15,000 with a more or less of a normal differential, then that's probably appropriate. You may be looking at something like pneumonitis. You may be looking at, again, allergies will do it. Mm-hmm. So if the hematologist looked at you and said that he or she does not believe that you have blood dyscrasia, that's why you went. They looked you over. Now, is it a good thing or a bad thing that they may or may not have done, let's say, a bone marrow aspirate? Oh, let me tell you, bone marrow aspirates are not the most pleasant of all tests to have done. So if the and that's how they earn their living. So if the hematologist isn't going to do it, I would be listening to the hematologist on this one. And I don't say that real often.
Iggy is asking a question that it just reminded me. I'm also getting my second shot the same day I'm going to the dentist.
Why would you do that?
Because I love my pain.
It's not going to hurt you to do it. But I'll
Iggy's
tell you
doing
what.
the same thing. He's getting a filling replaced at the same before he gets his second Pfizer shot. I'm doing it in the opposite order. Is that any side effects? Novocaine?
No, there's no side effects at all. But if you start feeling crummy,
it's your own
fault. It's usually, Iggy, it's the next day. So if you get the inoculation, let's say at 10 o'clock in the morning, and then at 12:30 you're going to be at the dentist, it's not going to bother you very much. But if you go the following day, it's going to be difficult for you necessarily to sit still for at least 4 or 5 hours. The aggravation that you see from these inoculations typically happens the night of or the next morning.
So I think I've got a window then.
Oh, you got a window. You're going to be okay. And either way, it's not going to make any difference other than the fact that you're going to sit there. And if the dentist or the hygienist leans into your arm, you're going to know it. So get your shot on the left side.
Well, it is. I think they've been doing left side only. So I think that will work out in your favor as well. It might.
Okay, I'm left-handed. Okay, they did it my right side. It didn't work. It worked out better for me that way because I use my left hand.
Maybe there's something to that. I don't think they asked. Melanie says CVID, common variable immune disorder.
Yes.
And PID is primary immune disorder. This person receives gamma globin every 28 days in the IVIG, to be clear. So, yeah.
Yeah.
I don't know. She was asking about whether or not get the dose. Get the vaccine.
Get the vaccine. The worst thing it's going to do is not work. Okay, and it's not going to cost you anything to do it.
I think we have Cadillac George on the line.
Oh, good for George.
Yeah, let me see if he's here or not. I think Linda's still talking to him in the other room. 407-422-1212, or for that matter, you may text in. A lot of people are prone to texting nowadays. I don't know what that is.
Well, they're shy.
It's the newfangled way. 23680 is the text line for us here at News Radio WFLA Orlando. We're coming up on a break, though, Doc, so I don't know if we're going to have time for George or not at this moment. We could take him the next segment.
We'll get him at the next segment, but I want to finish. What do we have, a minute to go?
Yeah.
Okay.
Like that.
What I'd like to do is to mention what should you have done on an annual basis. Let's say that you're a real person, an adult of 35 or 40 years of age, in addition to the sort of stuff that you're probably going to get, which is a CBC, liver enzymes, cholesterol or lipid panel, and your analysis. And you need to be looking at the sorts of things that are most likely going to reveal trending. Number one, get a uric acid level. Now, that's not routinely done, but one of the modulators of inflammation that's missed most frequently is uric acid. get a uric acid level. Why? Because those aches and pains that you think are coming from soccer or baseball could actually be early gout. When that happens, you can prevent an awful lot of joint damage by simply taking a $12 a month medication.
That's it. Oh,
Pearl of wisdom.
George just called in to say he thinks that my name is really cool and that I probably am a very foxy lady. Thanks,
George, you're right, and she
George.
is.
Not bad for a 75-year-old dude trying to hit on
Oh,
the
he is hitting on you.
co-host. I know.
Oh, George?
I'm aware. I can tell these things. It's not my first party. Yeah. All right, we're going to take a quick break. We got another segment to go, 407-422-1212. But if you actually have a medical question and not just a compliment for me.
There you go.
And now, look, I've lost it. Wait. I saw it. There it is. Boom. I got it. That is so hard. Yeah, that was what he called in, and then I was like, is he still there? He goes, no, he's gone.
Yep.
Seriously, George.
He may be in his 70s, but he's not dead.
No, obviously not. I see this. I'm not sure if I could plan ahead here or just let it skip all over the place and tell me what time we're supposed to come back. Every time has been off. When it tells me a time, and then all of a sudden it changes, and then it changes, and then it changes a little more. And it shouldn't do any of that.
Sounds like it's time for engineering.
They were all two of them were on vacation last week. Oh, man. Hey, guys, thanks so much for joining us on Facebook and the other social media platforms. It's always good to have you around, especially on a rainy day here in Central Florida. Yeah. It's weird that Iggy asked the same question I was going to ask you because I am doing it. I'm doubling up, and I think I may actually have scheduled at the same exact time because I'm an idiot.
Well, no. I mean, it's like anything else. When you get the vaccine, it's not like scheduling or calling up to get a reservation for a dinner. You don't have a lot of choice.
Yeah, I know.
They're going to tell you when they're going to do it, when you're available, and when your dose is going to be there. And if you don't show up, there will be somebody else to gladly take it, and good luck trying to get back in line. So, and the same thing is true of the dentists.
Yeah, I know.
Yeah.
And they're both exactly scheduled for the same time.
Yeah.
Although last time I got there early and I was like, hey, I'm early. Can you take
And
me for my
took care of
shot? Yeah, I didn't wait as long. Yeah, they're not that far from each other. I think I'll be okay. Oh, my gosh. People. All right. Let's see. Supposedly, yeah, it's still changing. All right. Give me a sec here.
This technology is supposed to make it easier.
Oh, you stop. The heck you say. It is technology. Whether or not it made it easier, I got nothing. Yep, it just changed. Now it was 22. Now it's 24 seconds. Saying nothing. Okay, so anyway, guys, thank you again for joining us. Let's see. We have the same doctor. Do we have the same dentist? I don't know. My dentist is right down the street. So
Hard to know.
yeah, it's hard
So,
to know.
Iggy, we can't mention that on the air.
Yeah, I can't tell you. Yeah, because then, everyone will go there, and then I won't be able to
But
get
just
up.
between you and me, Iggy, they talk about you.
We do know. Jeez, oh, man, it's not true. It's not. Anyway, by the way.
It still is kind of interesting, though, with all the controversy
Yeah.
over getting this vaccine. Now, by now, you haven't seen people dying underneath the bridges, have you? Well, if you get this a month later, people are going to start dropping dead because Bill Gates wants you to?
Do answer
What?
this quickly.
Go for it.
Hey, there we go. I think we might be back. Hey guys, welcome back to Stages of Life Radio every Sunday afternoon 4 until 5 with Dr. David Klein. I am Melissa Fox. I have a question. Why did the Orange County self-serves, they went to 18 years for the vaccine,
Yeah.
and they went to the J&J, one dealio.
Well, okay. The J&J was the only one that was really checked against folks under the age of 18.
Thank you. See, got your answers. People ask the questions, and I answer them to you.
Yeah, why Pfizer at 3 weeks and Moderna at 4 weeks?
Yeah.
Because that's how they tested it. So when they went and got their application, they had to go along with their testing protocol.
The results, yeah.
But could they be done at 3 weeks, 4 weeks? The answer is affirmative. Would it make any difference? The answer is no. And in fact, after one shot of the Moderna or Pfizer, your likelihood of coming up with antibodies is much higher than it is with the J&J anyway. So just one shot does better than of either one of the Pfizer or Moderna is better than the J&J in terms of predictive immunity.
Right, but I think you said, first of all, it was tested on younger people.
Yes.
That's why they're doing the Johnson & Johnson. Second of all, the chances of them coming back for the booster shot
is much less.
Much less. So they'd rather at least get some sort of herd immunity on the.
As best you can.
Yeah.
Getting a kid to go in and get a single flu shot is a chore. Mom, I don't want that.
Well, the needle.
So yeah, I mean it's really just such a traumatic experience after all. Junior little junior snowflake. So it's that or pass it on to grandma in the nursing home. Grandma, dead grandma now. You do not want to go away without getting your vaccine. Really. I mean, this is like just a patriotic responsibility. This is your responsibility to your community and to your country.
What do you have to say to those people out there who aren't listening? But
they're not listening. How can
they're
they hear
not,
us?
no, not listening because they refer to our wonderful governor as Death Santis. Would you give an answer to some of our listeners to come back against that?
He's the best governor in the country. Okay, we have a state that is actually operating and has been. States like California and New York are belly up because guess what? We were led by a better leader than either of those two states. Did you see a lot of self-congratulatory behavior with DeSantis? The answer is no.
See that 60 Minutes attempted smear piece last week?
Well, that was basically an attempted assassination on DeSantis.
Yeah, unfortunately, you know what it did?
He's
it brought him
smarter
to
than
the
they.
forefront on a national level.
Yeah.
And people are going, "Oh, this guy! Look at what he did."
Yeah,
And Texas was like, "Hey, we like Florida."
Right? They thought that DeSantis was an idiot like Cuomo. Okay, no. Harvard-trained attorney. I think he can think on his feet pretty darn well, and he did.
Yeah.
And they didn't give him an Emmy. Well, that's the only thing I didn't like about it. No Emmy.
Well, I think it was more of a distraction to keep Cuomo's quiet. Cuomo's deal quiet or whatever.
What do you do? We're going to have to light a fire someplace else.
It backfired.
It backfired pretty well.
Sarah Grace is on our Facebook feed at Stages of Life Medical Institute. Go ahead and like us and click the notify button. That way you'll know when we go live, because it's not just Sunday afternoons. Every other Tuesday night he's live as well with the Connection show.
Oh, I see what.
And Sarah's saying, do people shed the virus after getting any of the vaccines?
Okay, let's think that one through for just a second. I'll let you answer this with your own understanding of what's going on here. So when you give somebody a vaccine that does not have all three major genes of the virus, which means it can't replicate. So you're not actually getting the virus when you get the Moderna or the Pfizer vaccine. You're getting a piece of mRNA, but not the three genes that are typically present.
Right.
So no, you cannot produce the virus after the vaccine. Therefore, you can't shed the virus because you don't have the genetic material that it would be necessary to do it. When you get the virus, that virus replicates trillions and trillions of times, and you are spitting out virus like you wouldn't believe. That's where the infection comes in. But when you get the vaccine, there is no virus production anywhere in your body or any place else. So would you shed the virus? You couldn't shed the virus. Should you be ill when you get the vaccine, as happened to me? Okay, I was exposed on the 1st of January. The 2nd of January, I started feeling odd. The morning of the 3rd, I got the shot, and the evening of the 3rd, I found out that I was positive. So I was shedding that virus. Okay, that can happen. My lovely wife, Tess, was exposed on the 1st, started feeling puny on the evening of the 2nd or 3rd, got tested on the 4th, and we found out that she was positive that night. So she also was shedding the virus. So the fact that you get the inoculation doesn't stop somebody who is otherwise and appropriately ill from shedding the virus. So the question is, in the context that you're asking it, no. But now you know why, okay? Because it's physically impossible. On the other hand, if you get a live virus vaccine, then you're going to produce the virus. That's just the way it works.
That's not the way this vaccine is set up at all. And a lot of people, either they refuse to believe the science, they refuse to believe that the coronavirus vaccine has been around for animals for
20 years.
Yeah, at least more than that, I think, really. But they didn't do hardly any testing. Well, they didn't have to do a lot of testing because they already did a lot of testing over the years,
And in fact, it's harder to get a medication or an inoculation in the veterinary community than it is in the human.
Exactly.
For reasons, I guess you'd have to ask PETA what the real reason is. But you can't get medications cleared by the FDA in any less time than it does to do it for human. And in fact, it generally takes longer.
So
the reason for this, you're going to have to talk to an FDA bureaucrat to figure out why that is.
I'm not worried about that, though. What I am worried about is people going, I ain't getting the vaccine. They're going to put some sort of ID or, or this or that, or it's babies.
An RFID. Yeah, there we go. So, yeah, you're going to get an RFID chip inserted through that little teeny tiny needle. Well, number one, you're not that important.
Right.
Number two, nobody cares enough about you to keep track of you. And by the way, that phone that you use all the time, they're tracking you right there. And if that weren't enough, they're tracking your car.
Yep.
Guess. Oh, and what about the chips that are sitting there on your credit cards? You're worrying about your shot.
Got a low jack in your wallet.
Man, there are so many more things that you need to worry about. Not that.
This is not one of those things.
Yeah, they want to keep you alive so you can pay taxes.
I know. I keep telling you. And the other thing about this, the vaccine's made of aborted fetuses. Seriously?
Why would they? Why?
Why would there be that many aborted fetuses? First of all, why would they do that? Second of all, and third, we just told you it's an RNA strain.
Well, actually, that's what they're using. Are all those migrants coming through the southern?
Stop it! Stop!
Yeah, I mean,
someone is going to walk away with that information and start pushing it.
Well, they got to start a rumor somehow.
Don't. You bad. Okay, so anyway, for more information about the doctor and the medical, what is it, the insurance that you take and don't take, and start the new patient process, just go to stagesoflifemedicalinstitute.com. For anything we talked about today, if you need a review, the podcasts are available, the videos are available as well. Go on your social media platform, your favorite one, and look for Stages of Life Medical Institute. Doc, I think you said it all.
I think, except for our telephone number.
Oh, yeah, okay.
Which is 407-679-3337. Give us a call. We'd love to have you as a patient.
See ya.
You've been listening to Stages of Life Radio with Dr. David Klein. Check out stagesoflifemedicalinstitute.com or stop by 1917 Booth Circle in Longwood near the intersection of I-4 and 434. Call 407-679-3337. That's 407-679-3337. Dr. Klein accepts most insurance and Medicare, too. Join us next Sunday at 4 p.m. on News Radio WFLA Orlando.